Hey, good morning. It's Dr. Shirley. How are you today? Thanks for joining on this beautiful Friday. I'm up in Rochester today on beautiful Lake Ontario. A little stiff breeze coming out of the north, but still a gorgeous day. And these are the days that we dream about during the winter months, I think. So today we're going to be talking about your fingernails, okay? May not sound like all that exciting of a subject, but what you're going to learn today is that your nails are actually kind of a window to what's going on inside of your body. Your fingernails actually will tell what's going on maybe with certain organs, with certain vitamin deficiencies. So we're going to talk about those, and we're also going to talk about how to correct those imbalances as well too, so we can obviously make ourselves better naturally. So I'm a doctor of naturopathy, and for those of you that don't know what that is, it's basically meaning that we're going to help to get the body well naturally, without medications, without different prescriptions, without any invasive procedures, but by using natural foods, natural herbs, natural environment, meditation, yoga, all of those, good things that are good for us, because the answers are really all inside of us. And so a lot of the work that I do is like detective work. I do have a bachelor degree in health and wellness counseling, and so I've done a lot of emotional and psychological work with people as well too over the years. I'm a best-selling author as well. My book is called Healthy, Lean, and Sexy at Any Age. I'm really proud of it. I wrote it just over a year ago. It became an Amazon bestseller almost overnight. It really brought me to tears. I was a #1 in 5 different countries. So that's a lot about what, information here online, but that's on Amazon. You can get on your Kindle for free. Really cool. If you want a hard copy, I think it's like 10 or 12 bucks. So yeah, so that's my background. I've been doing this for a long time. So let's get at the nails, okay? So nails are more than decorative. For women, we sometimes may think they're decorative. Even as little girls, we're taught to polish our, a lot of toxins in them, but the nail polish, but we're not talking about that today. We're going to talk about the condition of the nails. Our growth rate is probably about just 2 to 3 millimeters per month on there, but during pregnancy, our nails grow even more, and during puberty, our nails grow more. Why? Probably because we have a lot more nutrition, and we've got a good amount of hormones that are circulating around in our body. Is actually a lot more balanced, during those times of our lives. And if our nails are not growing, then that's also an indication that we do not have enough nutrition inside of our body. It's going to be kind of a window, like I said, and really affect the whole general state of your body is going to be shown in your nails, because it's a living organism, and they're protein, and our whole body is made up of living organisms. So why would it be any different? Just like with our eyes, there's a study of iridology I'm going to end up talking about, because our eyes will also show what's going on in our body. So our nails are influenced by our nutrients for sure, and we'll talk about those specifics, and also by trauma. Trauma could be, sometimes if we've had a car accident, if we've had any surgery. I remember I had a really bad car accident. My hair started falling out. I don't remember the condition of my nails, but we really start to see that trauma can affect our body in so many different ways. Certain medicines are going to make a difference on how your nails look, as well as your lifestyle. This might include smoking or drinking, and those have an effect as well too. So, good morning, Liz. Nice to see you. Hey, Sarah. Hi, Cindy. Thanks for joining us. So let's talk about what the nails are. They're layers of protein, okay, and they're actually keratin is the main point, which is basically a protein layer. So there's layers and layers of protein, that go. You can understand that protein, your amino acids, are really going to make the biggest difference. Oh, hey, good morning, Michael. Mark, you're here. Mark's watching. I've done like 45 shows. I'm like, you never watch my show. So it's nice to have. Hey, Charlie, good morning. How are you? So if our nails are yellow, okay, a yellow nail is indicative of a lot of different things that can be going on inside the body. First of all, when we age, our nails can be yellow. So when I mean aging, I'm meaning more 70s, 80s, okay? Some of you people think aging is being 30 years old, okay? I'm talking like 70s and 80s. Our nails can start, to yellow, both our toenails, and our fingernails, okay? If someone is a smoker, that's another way that we're going to see that we have yellow nails. And then also, too, if we wear nail polish, okay, and we are taking that nail polish off, and the nails don't correct themselves, because a lot of times they will be yellow there, too, okay? But if they don't correct themselves in a couple days, you may want to look at what that problem is that's going on. If your nails are thick, this could be toenails as well as regular nails, crumbly and or yellow, this can indicate a fungal infection, and I'll talk about what that is. And that can be a very common place to be. It's actually, the source is usually candida, just like nail fungus, the same as, it's probably a technical name, but it's called, jock itch, or cradle, how we say that wrong, cradle cap, with the babies. That's all yeast. That's all fungal base. That's something that's going inside the body and just choosing to come out in the nail beds. It can also be related to the fingernails, not just the toenails. It's also, yellow nails can also indicate that your thyroid is not functioning as well as it can be. And we've talked about thyroid quite a bit. And, with the thyroid, what's measured as being normal, is really pretty small. So most people I have found really do have a weaker thyroid. So you want to work with a good practitioner to do that, because your thyroid is super important. So if you've got yellow going on in your nails, take a look at your thyroid. The other thing it can be a precursor to is that you may be coming in a pre-diabetic state. Again, this is easily tested through your medical doctor. Okay. And, so if that's going on and you're not seeing, a change in that, or it's not varying and it's staying at a yellow state, make sure you get your blood tested to see if you're in any kind of pre-diabetic condition. Yellow can also indicate respiratory distress. This could be, maybe you've got a bronchitis. I mean, obviously you'd know if you had a bronchitis, but maybe it could indicate maybe a pneumonia or something along those lines. So the lungs are indicated in anything that is yellow. Cracked nails or brittle nails, okay? A lot of these can be caused by toxins and chemicals. You hear this over and over, but when we take in too many toxins or too many chemicals, we can start to have deficiencies that show up, because a lot of these chemicals and toxins will pull out of our minerals, all right? And when we leach minerals out of our body, then we don't have minerals to create good, healthy, strong nails, all right? Also, if you live in an area that's low humidity, you may have more cracking going on. Fungus is also related to drying and cracking, as is, again, the thyroid. So from what I've been reading and researching, the thyroid really seems to show itself quite a bit in the nail health. Deficiencies can also be part of this, and a lot of it is vitamin A. Okay, vitamin A is one of the main, vitamins that are going to take care of your hair, your skin, and your nails. Those are all related. Usually if you're having trouble with your nails, you might be having trouble with your hair. We talked about that the other day, or you may be having trouble with your skin as well too. Hey, good morning, Shauna. Nice to see you. The other thing that we may be lacking are B vitamins, and particularly biotin, okay? Biotin is actually, vitamin H, which you don't hear a lot about. Like, what's vitamin H? It's the same thing as biotin, and you see biotin in your shampoos, in some skin products, and it's super, super important, for your nails. If you're someone that does not take a supplement on a regular basis, you're probably going to get deficient over time. So I wonder when they say this is age related, or our nails get weaker as we get older, is that just because we become more nutritionally deficient over time? I mean, that's certainly possible. Most of us here in the U.S. are actually mineral deficient. Okay, we're, of all the food, of course, we eat so much. We eat more than any other country. We're fatter than any other country, but we have huge deficiencies with vitamins and minerals, within our body. Now, how about those horizontal ridges? Okay, horizontal ridges, and I had these last year, and I remember going like, wow, what is that? That was I had a really extreme year of stress and grief and a lot of other things that were going on in my life, and it showed itself, in the nails. So what it means when your nails are showing those ridges is that your body is dealing with other stuff, okay? They don't consider your nails important, so it's working on other things. Maybe it's your kidney, maybe it's your liver, maybe it's your nervous system, but it really indicates that your body is overloaded in some ways, whether by stress, whether by disease, by mental, physical. Your body's overloaded and it just doesn't have the time or energy. Nose and nails aren't all that important. Liver, heart, lungs, obviously more important in the lungs, more important rather in your heart, than the nails are. The other thing that can be going on with horizontal ridges is your circulation. So you do want to take a look at that, and we'll see that in a couple other areas. And we'll see a deficiency possibly in zinc, okay? And if you have a major deficiency in zinc, you're definitely going to see those ridges in your nail, and those are your horizontal ones, okay? The ones, what horizontal is. Okay, we're not doing third grade here. So diabetes is also indicated here, so we start to see that what goes on in our hands can definitely be related to what's going on with our pancreas and our balance within our body. Hey, Jean, nice to see you. Jean's a health expert too. Vertical ridges, okay? Vertical ridges are related mostly to magnesium, okay? Magnesium is important for so many different things within our body, for our heart, for our blood pressure, for relaxation, for our adrenal glands. It can also be related to B12. Now, we rarely get enough B12 in our body, okay? If you're vegetarian, you're probably not getting enough at all, okay? But B12 B12 is super important for our body, and remember, our B vitamins are water related. Okay, they're water. They're going to soluble. I'm sorry, they're going to go out with everything that we eat. They don't stay within our body, so you want to replenish those on a very regular basis. Vertical ridges can also indicate you're lacking silica, and I'm going to talk about some herbs. Silica is what makes things strong. Okay, you know when your nails are hard and they click, 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 and when your hair is strong. Silica is the same mineral, I think we talked about it this week, that makes seaweed like so super strong, where you really can't pull it apart. Can be related also to anemia, and anemia is really a lack of hemoglobin, lack of oxygen, is what it is. Things like bee pollen could be a great choice, because bee pollen helps to build your hemoglobin and your hematocrit, and these are both components of bringing oxygen to the brain and to the rest of our body. We need oxygen, which is why people who exercise are always so much healthier, because they're really getting oxygen to their whole body. Now let's talk about some dark colorations. Dark discolorations, if you start getting like black streaks within your nails, your toenails, fingernails, you need to go see the doctor like right away. They can indicate different melanomas in particular. Okay, it's just weird how that would show up. Maybe you wouldn't know you had a melanoma, on your back, or someplace on your face you didn't even know it was a melanoma. But if you've got some dark black, I'm talking black ridges, black streaks, kind of things in toenails or in your fingernails, that's something to be concerned ASAP. Now, have you ever heard of something being concave? Okay, kind of and it's thin. Okay, very thin. It's a scooped away kind of nail. It's called a spoon nail. This indicates again a difficulty with the thyroid, like a thyroid, which really means your thyroid is weak. Okay, hyper is when it's running too high. Hypo cardiovascular issue as well too. So again, doesn't mean that you don't go get things checked out. I'm not here to diagnose. I'm not a medical doctor. I don't diagnose. I don't treat. You got something going on, you're concerned about it, go see your doctor. Okay, I'm all about emergency medicine, and I want you to learn from me from health perspectives to what to look at and how we can cure our body naturally and heal things naturally, for sure. Okay, but if you got something serious going on, you always want to check in with your doc. Good morning. So let's talk about blue nails. Now, blue nails are something. Blue is the little crescent shaped thing there. They colors in there. Again, if you see the red in there, that is. And blue is oxygen related, as you might imagine. Like if someone goes blue lips, blue face, this means there is a lack of oxygen to the body, sometimes serious. It can indicate a lower hemoglobin. Again, that is the oxygen carrying component, and the iron carrying component to your body. So again, I like bee pollen for that, because it helps to build up your iron naturally. A lot of iron tablets will constipate, and most people don't like that. Doesn't feel good, right? So, just do something, nice to increase your oxygen in that way. Blue nails can be related to asthma. Again, you'll see the correlation, between the oxygen. Emphysema, obviously a lack of oxygen. So people may be suffering with that, or even with pneumonia. It will show a little bit, and it will also indicate difficulty with an arthritis, even in RA, rheumatoid arthritis. More difficult to deal with even than an osteoarthritis, which I'll talk about in one of these classes. So let's talk about fungus a little bit. That is a big thing. You see a lot of, you ever see those toenail commercials? It's just crazy. Like these things usually don't work. Okay, I've seen so many people over the years, so many clients. It's very common, toenail fungus is, and it can be unsightly and it can be embarrassing, especially in the summer if you're wearing sandals and you don't like people looking at your feet. So the things that I've seen to be helpful are tea tree oil. Okay, tea tree oil, you can do yourself a soak. All of this stuff takes a little bit of time because it's hard to get anything to stay on your toes. I guess you could use some. I've used Silver Shield gel. Okay, Silver Shield is antiviral, antibacterial, and when you're putting on any of these things topically, like a tea tree oil or the Silver Shield, which is like a colloidal silver, either in gel or in liquid form, you got to buff up those. You got to buff up the nails a little bit because they have built up such a hard surface. It's hard to get anything to penetrate, and I think that's probably why the meds don't work as well too. So you got to really maybe use like a nail brush kind of a thing. And them can absorb. So you could put on some tea tree oil. Hey, Lori, how are you? Some Silver Shield on there. And you could put your feet in some little plastic bags and tie them off lightly and put that on at night and go to bed. Or you could sit like in a tub with your water soaking away. Maybe if you like to watch the news or do something, dealing with any kind of fungus. Now, some of the herbs that are helpful, we talked about this the other day with hair, is horsetail. Okay, horsetail, when you think about a horsetail, right? Some of these herbs are so cool. It's probably strong as heck. I've never pulled on one, but I got to think it's probably pretty strong. Horsetail, the herb, is usually included if you see like I've worked with a formula called hair, skin, and nails. Anything, if you see any of these herbal formulas, look for horsetail, because that's going to be the best overall herb for you to strengthen nail and to strengthen your hair. It's full of calcium, it's full of silica. Silica is the most important mineral as far as creating strength. B vitamin is also important. We talked about that. And vitamin C is very important. Why? Because it helps to build collagen. What does collagen do? It's a protein, helps with our skin, helps with our hair, and helps with our nails as well too. The biotin we talked about, the vitamin H, and then also your minerals. Your calcium, magnesium is important for every single aspect of your body. I mean, in my opinion, there's no reason not to take calcium, magnesium. Of course, my opinion is also like, why aren't you taking everything? You know, I take stuff every day. I maybe I just ask you that. Why would you not want to feel as good as you possibly can? I think we all want to, but it does a little bit of discipline and a habit. It takes a little while to get a habit. When you start to feel better and you actually start to see changes within your body, you're going to be pretty excited, I'm sure. Flaxseed is also important. Why? Because it's got a lot of your fatty acids in there, and fatty acids are going to be helpful for any kind of cracking, any kind of splitting, drying with the nails. All of those things are going to be indications you are lacking of fatty acids, and fatty acids also help with the permeability with the cells. Okay, so our cells, in order to receive nutrients and to excrete the waste, they have to have what's called permeability. Okay, they have to be able to be penetrated, so to speak. And so our permeability of our cells has a lot to do with the amount of good fats that are in our body, and so your essential fatty acids are important. Lori wants to know what's good for nail fungus. I'll say that. I'll give you some personal advice if you've got a particular situation for yourself or somebody in your family. Other things that you can do, so your fatty acids again might be with your lecithin, your essential fatty acids, your vitamin E. These are all going to be really, really good to help with any of the drying or the cracking. Biotin, super important. Again, you may find that in shampoos or even in some of your hand creams. Olive oil is another wonderful, wonderful, and a very easy thing to do. You can put some, good olive oil, okay? I should talk about that someday, as well too, because there's a lot of olive oil that's sold as extra virgin olive oil, and it's not, or virgin or natural, and it's a big scam coming out of Italy, and because they know that people want, something that's got that name on it, but you got to make sure it's good. So get yourself a very good extra virgin olive oil, preferably from Italy, okay? And this has vitamin E in it, and then what you can do, you actually massage it onto your hands, put it onto your nails, let it soak in for about 15 minutes. Now, let's say you wanted to do this at bed. You can get yourself some of those little plastic gloves you get at the paint shop or something like that. Put this olive oil on your hands, put the gloves on, and go to bed, okay? Simple. It absorbs into your system, and it's going to make wonderful, wonderful effects after just a couple treatments. The other thing, as you might imagine, is coconut oil. Of course, coconut oil is like, I think some properties already written a book, right? 101 wonderful ways to use coconut oil. Well, 100 ways to use coconut might be kind of thing. Massage it into your hands, massage it into your nails. You can massage it into your feet too, because with your feet, the coconut oil is antiviral and is anti-fungal as well too. Now, I've never done this. This thought is just coming to me, but my thought is that you could put coconut oil on your feet along with the tea tree oil, and it would probably be a wonderful combination because it does so many wonderful things to your body. So, good morning, Justin. How are you? Lori, nice to see you. So, is there anyone have any questions? If you like what you've heard this morning, if you could just put a comment down there, or just say hello or where you're from, I'd really appreciate that. We're getting a lot of great play on a lot of the videos. I'm really enjoying that. I'm also available for consultations, and I do a lot of speaking, both here, in the country and out of the country. So I'm willing to go to a lot of different places, to share this knowledge, because I really firmly feel that, if we can continue to spread this knowledge out to the world, we could all be so much healthier and really live the lives that we want to live. So have yourself a wonderful weekend, okay? We'll be back again on Monday, and I look forward to seeing you then. Take care. Bye.